Question 1. Cost-benefit analysis shows that investing in a robust, predefined crisis management plan significantly reduces the potential for patient harm and financial penalties during a widespread public health emergency. Yet a sudden surge in demand for critical medical supplies is overwhelming the organization's inventory. Which of the following actions best demonstrates professional adherence to healthcare risk management principles and regulatory compliance in this crisis? Option A. Bypass the formal crisis management plan and authorize the purchasing department to aggressively procure all available supplies from any source, prioritizing speed over established vendor relationships or regulatory checks. Option B. Halt all non-essential operations and await detailed, step-by-step instructions from federal and state health authorities before taking any action to secure additional supplies. Option C. Immediately activate the organization's established crisis management plan, convening the designated crisis response team to assess the situation, coordinate resource acquisition according to pre-approved protocols, and ensure communication with relevant stakeholders. Option D. Delegate the entire responsibility for managing the supply shortage and response to the emergency department manager, trusting their on-the-spot judgment to handle the crisis. Correct answer is C. Immediately activate the organization's established crisis management plan, convening the designated crisis response team to assess the situation, coordinate resource acquisition according to pre-approved protocols, and ensure communication with relevant stakeholders. Explanation: this scenario is professionally challenging because it requires balancing immediate operational needs with long-term patient safety and regulatory compliance during a crisis. The healthcare organization faces a critical decision that impacts its ability to respond effectively to a widespread public health emergency, directly affecting patient care and potentially leading to significant legal and reputational damage if mishandled. The pressure to act quickly must be tempered by a thorough understanding of the organization's crisis management plan and its adherence to relevant U.S. healthcare regulations. The correct approach represents best professional practice because it prioritizes the activation of the pre-established crisis management plan, which is designed to guide the organization through such events in a structured and compliant manner. This plan, developed in accordance with U.S. federal and state healthcare regulations, e.g., HIPAA for patient privacy during data sharing, OSHA for worker safety, and potentially CMS requirements for emergency preparedness, ensures that response efforts are coordinated, resources are allocated appropriately, and legal obligations are met. Activating the plan involves engaging the designated crisis management team, which includes representatives from key departments, ensuring a comprehensive and informed response that mitigates risks and protects patient well-being. This aligns with the ethical imperative to provide safe and effective care, even under duress, and the legal requirement to maintain operational continuity and patient rights. An incorrect approach that focuses solely on immediate resource acquisition without consulting the crisis management plan is professionally unacceptable. This failure represents a significant regulatory and ethical lapse. From a regulatory standpoint, bypassing the plan could lead to noncompliance with emergency preparedness requirements mandated by agencies like CMS, which expect documented and tested plans. It could also violate patient privacy laws like HIPAA if patient information is mishandled during the rush to acquire resources, or if the response is not adequately documented. Ethically, it demonstrates a lack of preparedness and a potential disregard for established protocols designed to ensure patient safety and organizational integrity during a crisis. Another incorrect approach, which involves delegating the entire crisis response to a single department without interdisciplinary input, is also professionally flawed. This siloed approach can lead to fragmented decision-making, overlooked critical dependencies, and a failure to address the multifaceted nature of a public health crisis. It violates the principle of coordinated care and risk management, potentially leading to regulatory violations related to emergency response coordination and a failure to meet the diverse needs of patients and staff. Finally, an approach that delays response to await further directives from external agencies without initiating internal crisis protocols is professionally inadequate. While external guidance is important, a healthcare organization has an independent responsibility to activate its own crisis management plan to protect its patients and staff. Excessive reliance on external directives can lead to critical delays in patient care and resource mobilization, potentially resulting in adverse patient outcomes and regulatory scrutiny for failing to implement proactive emergency preparedness measures, as required by U.S. healthcare law. Professionals should employ a decision-making framework that begins with immediate situational assessment, followed by the prompt activation of the organization's crisis management plan. This plan should serve as the primary guide, dictating communication channels, team roles, resource allocation strategies, and documentation requirements. Continuous evaluation of the situation against the plan's provisions, coupled with interdisciplinary collaboration and adherence to regulatory mandates, is crucial for an effective and compliant crisis response. Question 2. The monitoring system demonstrates a persistent trend of medication errors in the neonatal intensive care unit, specifically concerning the administration of high-alert medications. The risk management team is tasked with identifying the underlying causes and recommending interventions. Which of the following approaches would be the most effective and compliant method for this investigation? Option A. Conduct a failure mode and effects analysis, FME, of the high-alert medication administration process from ordering to administration to identify potential failure points and their impact. Option B. Review all submitted incident reports related to medication errors in the past year and implement recommendations based on the most frequently reported issues. Option C. Perform a strengths, weaknesses, opportunities, and threats SWOT analysis of the neonatal unit's overall operational efficiency to identify areas for improvement. Option D. Focus on individual nurse performance reviews to identify staff members who have made multiple medication errors and provide targeted retraining. The correct answer is A. Conduct a failure mode and effects analysis, FME, of the high-alert medication administration process from ordering to administration to identify potential failure points and their impact. Explanation. The monitoring system demonstrates a recurring pattern of medication errors in the pediatric unit, specifically related to dosage calculations for neonates. This scenario is professionally challenging because it involves patient safety, potential for severe harm, and requires a systematic approach to identify the root cause and implement effective solutions. The urgency is amplified by the vulnerability of the patient population. Careful judgment is required to move beyond superficial observations to a thorough understanding of contributing factors. The correct approach, failure mode and effects analysis, FME, represents best professional practice because it is a proactive risk assessment tool designed to identify potential failure points in a process before they occur or to understand existing failures in depth. In this context, FME allows the risk management team to systematically break down the medication administration process, identify potential failure modes, e.g., incorrect calculation, transcription error, dispensing error, assess the severity and likelihood of each failure, and determine the most effective controls. This aligns with regulatory expectations for healthcare organizations to implement robust quality improvement and patient safety programs, often mandated by bodies like the Joint Commission, if U.S. jurisdiction is assumed for CPHRM, which emphasizes proactive risk identification and mitigation. Ethically, it prioritizes patient well-being by seeking to prevent harm. An incorrect approach, relying solely on a strengths, weaknesses, opportunities, and threats, SWOT, analysis, is professionally unacceptable. While SWOT can provide a broad overview of internal and external factors affecting a unit or organization, it is not designed for in-depth process analysis of specific error patterns. Its weakness lies in its generality. It might identify staff training as a weakness, but would not systematically uncover the specific dosage calculation errors or their underlying causes. This failure to drill down into the process is a regulatory and ethical lapse, as it does not fulfill the obligation to thoroughly investigate and address patient safety events. Another incorrect approach, conducting only a superficial incident report review without further investigation, is also professionally unacceptable. While incident reports are crucial for initial data collection, they often describe the what but not the why. Without a structured tool like root cause analysis, RCA, or FME, the review may miss systemic issues, leading to ineffective corrective actions. This can be seen as a failure to meet regulatory requirements for comprehensive patient safety event investigation, and a breach of ethical duty to protect patients by not fully understanding and rectifying the causes of harm. Finally, focusing solely on individual staff performance without exploring systemic factors is an incorrect approach. This can lead to a punitive culture and does not address the underlying process or system flaws that may contribute to errors. Regulatory bodies and ethical principles emphasize a systems-based approach to patient safety, recognizing that errors often result from a confluence of factors rather than isolated individual failings. This approach fails to identify and correct systemic vulnerabilities, leaving the organization susceptible to future similar events. A professional reasoning process for similar situations should involve 1. Recognizing the need for a structured, systematic approach to patient safety events. 2. Selecting the most appropriate risk identification and analysis tool based on the nature of the problem, e.g., FME for process failures, RCA for investigating specific adverse events. 3. Engaging relevant stakeholders in the analysis. 4. Developing evidence-based, actionable recommendations. 5. Implementing and monitoring the effectiveness of interventions. 6. Fostering a culture of safety that encourages reporting and continuous improvement. Question 3. Assessment of a healthcare organization's risk management program reveals that the chief financial officer is advocating for significant budget cuts to the risk management department, citing a need for immediate cost savings. The CFO suggests that the risk manager's role should be primarily reactive, addressing only reported incidents, and that proactive risk identification and mitigation efforts are an unnecessary expense. The risk manager believes that a robust, proactive risk management program is essential for preventing future adverse events and protecting the organization's financial and reputational health. Which of the following approaches best aligns with the definition and scope of healthcare risk management? Option A. Reducing the risk management department's budget by 30% and reassigning risk management responsibilities to individual department heads to manage within their existing budgets. Option B. Focusing solely on investigating and responding to reported patient safety incidents and claims, as this represents the most direct and measurable impact of the risk management function. Option C. Implementing a comprehensive risk management framework that includes proactive identification, assessment, and mitigation of potential risks across all organizational functions, and educating leadership on the long-term cost-effectiveness of such a program. Option D. Dismissing any potential risks that are perceived as unlikely to occur, based on anecdotal evidence from department managers, to streamline the risk management process and reduce associated costs. The correct answer is C. Implementing a comprehensive risk management framework that includes proactive identification, assessment, and mitigation of potential risks across all organizational functions, and educating leadership on the long-term cost-effectiveness of such a program. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between immediate financial pressures and the long-term, proactive mandate of healthcare risk management. The chief financial officer's focus on short-term cost savings directly opposes the risk manager's responsibility to identify and mitigate potential future harms, which often require upfront investment. This creates a tension between operational efficiency and patient safety/organizational resilience. Careful judgment is required to balance these competing demands while upholding ethical and regulatory obligations. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the systematic identification and evaluation of risks, aligning with the core definition and scope of healthcare risk management. This involves a proactive, data-driven process to anticipate potential adverse events, assess their likelihood and impact, and develop strategies for mitigation. This approach is ethically sound as it places patient safety and organizational integrity above immediate financial expediency. It aligns with regulatory frameworks that mandate robust quality improvement and patient safety programs, implicitly requiring a comprehensive risk management function. The CPHRM certification itself signifies a commitment to these principles, emphasizing a holistic view of risk that encompasses clinical, operational, financial, and reputational aspects. Incorrect approach is analysis. One incorrect approach fails by solely focusing on immediate cost reduction without a thorough risk assessment. This neglects the fundamental scope of healthcare risk management, which extends beyond mere cost containment to encompass the prevention of harm and the protection of the organization from liability and reputational damage. This approach risks overlooking significant potential liabilities that could far outweigh any short-term savings. Ethically, it prioritizes financial gain over patient well-being and organizational stability, Another incorrect approach errs by deferring all risk management decisions to department heads without a centralized, coordinated strategy. While departmental input is crucial, a fragmented approach can lead to inconsistent risk identification, a lack of standardized mitigation strategies, and an inability to identify systemic risks that span multiple departments. This violates the principle of comprehensive risk management, which requires a unified oversight function to ensure all organizational risks are addressed systematically. It also fails to leverage the expertise of a dedicated risk management professional. A third incorrect approach is to dismiss potential risks as unlikely without a formal documented process for evaluating their probability and impact. Healthcare risk management requires objective assessment, not subjective dismissal. This approach ignores the potential for low-probability, high-impact events that are a hallmark of healthcare risks. It represents a failure to engage in due diligence and can leave the organization vulnerable to unforeseen crises. Professional reasoning. Professionals should employ a systematic, data-driven approach to risk management. This involves establishing clear processes for risk identification, assessment, mitigation, and monitoring. When faced with competing priorities such as financial constraints versus risk mitigation, professionals should 1. Clearly articulate the potential risks and their consequences, both financial and non-financial, to relevant stakeholders, using data and evidence. 2. Propose risk mitigation strategies that are proportionate to the identified risks and consider cost-effectiveness over the long term. 3. Advocate for the integration of risk management principles into all organizational decision-making processes. 4. Seek to educate leadership on the value and necessity of proactive risk management for organizational sustainability and patient safety. Question 4. The efficiency study reveals that a newly implemented electronic incident reporting system is experiencing significantly lower than expected utilization rates among clinical staff. The risk management department has identified this as a critical issue, impacting their ability to proactively identify and mitigate patient safety risks. Which of the following strategies best addresses this challenge and aligns with best practices in healthcare risk management? Option A. Assume that the advanced features and user interface of the new system will eventually lead to increased adoption once staff become more familiar with it, and continue to monitor reporting rates passively. Option B. Implement a strict mandatory reporting policy with immediate disciplinary action for any staff member failing to utilize the new system within a specified time frame. Option C. Conduct targeted interviews and focus groups with frontline staff to understand their experiences, perceived barriers, and suggestions for improvement regarding the new reporting system, followed by tailored training and communication initiatives. Option D. Increase the frequency of data analysis reports generated from the existing low volume of incident reports to demonstrate the system's capabilities, without directly addressing the low reporting rates. The correct answer is C. Conduct targeted interviews and focus groups with frontline staff to understand their experiences, perceived barriers, and suggestions for improvement regarding the new reporting system, followed by tailored training and communication initiatives. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare risk management where a new incident reporting system, while technologically advanced, is not being fully adopted by frontline staff. The professional challenge lies in balancing the organization's investment in a new system with the critical need for comprehensive and accurate incident data to identify and mitigate risks. Failure to achieve high reporting rates undermines the very purpose of the system, potentially leading to unaddressed patient safety issues and regulatory noncompliance. The risk manager must navigate staff resistance, understand the root causes of underutilization, and implement strategies that foster a culture of reporting. Correct approach analysis. The correct approach focuses on understanding the barriers to reporting and actively engaging staff in solutions. This aligns with best practices in healthcare risk management, emphasizing a proactive and collaborative strategy. By conducting targeted interviews and focus groups, the risk manager can gather qualitative data on why staff are not using the system, whether it's due to complexity, lack of perceived value, fear of reprisal, or insufficient training. This data-driven, staff-centric approach allows for tailored interventions, such as system simplification, enhanced training, or communication campaigns that highlight the benefits of reporting and reinforce a non-punitive reporting culture. This directly supports the organization's ability to comply with regulatory requirements for incident reporting and quality improvement, such as those mandated by CMS or the Joint Commission, which require robust systems for identifying and addressing patient safety events. Incorrect approaches analysis. One incorrect approach involves solely relying on mandatory reporting policies and disciplinary actions for noncompliance. This approach is fundamentally flawed because it fosters a culture of fear rather than a culture of safety. It is ethically problematic as it punishes individuals for reporting potential system failures, which is counterproductive to risk management goals. Regulatory frameworks, while mandating reporting, also implicitly encourage environments where reporting is safe and valued. This approach risks underreporting of critical incidents, leading to a false sense of security and potential violations of patient safety standards. Another incorrect approach is to assume the new system's technical superiority will automatically lead to increased adoption. This overlooks the human element of system implementation. Without understanding user experience and addressing practical concerns, the system may remain underutilized. This approach fails to meet the spirit of regulatory requirements that necessitate effective reporting mechanisms, not just technologically advanced ones. It also ignores the ethical imperative to support staff in their roles and ensure they have the tools and confidence to report. A third incorrect approach is to focus solely on aggregated data analysis without investigating the reasons for low reporting. While data analysis is crucial, it cannot compensate for a lack of input. If the reporting system is not being used, the aggregated data will be incomplete and potentially misleading, hindering effective risk identification and mitigation. This approach is a failure to implement a functional reporting system, which is a core requirement for quality improvement and patient safety initiatives mandated by regulatory bodies. Professional reasoning. Professionals should employ a decision-making framework that prioritizes understanding the why behind observed outcomes. This involves 1. Data gathering. Collect both quantitative reporting rates and qualitative staff feedback data. 2. Root cause analysis. Investigate the underlying reasons for low reporting rates, considering system design, training, culture, and perceived value. 3. Stakeholder engagement. Involve frontline staff, leadership, and IT in the problem-solving process. 4. Solution development. Design and implement targeted interventions based on the root cause analysis. 5. Evaluation and iteration. Continuously monitor reporting rates and gather feedback to refine strategies. This iterative, collaborative, and data-informed approach ensures that risk management initiatives are effective, sustainable, and aligned with both regulatory expectations and ethical principles of patient safety and staff support. Question 5. The audit findings indicate that a nurse prepared a medication for a patient, but due to a labeling error on the medication itself, the incorrect medication was drawn up. However, before administering the medication, the nurse identified the discrepancy through a secondary check and did not administer the incorrect drug, thus preventing patient harm. Which of the following best describes the appropriate classification and initial response to this incident from a healthcare risk management perspective, adhering to U.S. regulatory frameworks? Option A. Do not categorize the event as no harm occurred and focus on other audit findings. Option B. Classify as a near miss and initiate a system-level review of medication labeling and dispensing processes. Option C. Classify as a documentation error and update the patient's chart accordingly. Option D. Classify as an adverse event and immediately report to the patient's physician and the State Board of Nursing. The correct answer is B. Classify as a near miss and initiate a system-level review of medication labeling and dispensing processes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires distinguishing between an adverse event and a near miss, both of which have significant implications for patient safety and organizational learning. The audit findings highlight a gap in the organization's ability to accurately categorize and respond to safety events, potentially leading to misallocation of resources, missed learning opportunities, and a failure to implement effective preventative measures. The challenge lies in applying the definitions of these incident types consistently and ensuring that the response aligns with regulatory expectations for reporting and improvement. Correct approach analysis. The correct approach involves accurately classifying the event as a near miss. A near miss, by definition, is an event that could have caused harm but did not, due to chance or timely intervention. In this case, the medication error occurred, but the patient did not receive the incorrect dosage, thus preventing harm. This classification is crucial because it signals a potential system vulnerability that, if addressed, can prevent future adverse events. Regulatory frameworks, such as those guiding healthcare risk management, emphasize the importance of identifying and learning from near misses to proactively improve patient safety. This approach aligns with the principle of continuous quality improvement and the ethical obligation to prevent harm. Incorrect approaches analysis. Classifying the event as an adverse event is incorrect because it implies that harm occurred to the patient, which is contrary to the scenario's description. This misclassification could lead to unnecessary reporting burdens, potentially inaccurate data collection, and a focus on individual accountability rather than systemic issues. It fails to recognize the opportunity for learning from a near miss and could create a culture of fear rather than one of open reporting and improvement. Failing to categorize the event at all is a significant regulatory and ethical failure. It represents a breakdown in the organization's risk management processes. Without proper categorization, the event cannot be effectively analyzed, trended, or used to inform corrective actions. This inaction directly contravenes the expectation that healthcare organizations will proactively identify, analyze, and mitigate risks to patient safety, as mandated by various healthcare quality and safety standards. Treating the event solely as a documentation error, without acknowledging the potential for medication administration error, is also an incorrect approach. While documentation is important, the root cause analysis must delve deeper to understand why the incorrect medication was prepared and how the error was caught. This approach overlooks the critical safety breach that occurred during medication preparation and dispensing, failing to address the underlying system issues that allowed the error to progress to the point of near miss. It misses the opportunity to strengthen medication safety protocols. Professional reasoning. Professionals should approach such situations by first understanding the precise definitions of adverse events and near misses within the relevant regulatory framework. A systematic review of the event's timeline, identifying what happened, what could have happened, and why harm was prevented is essential. This involves engaging with the reporting staff, reviewing relevant policies and procedures, and conducting a thorough root cause analysis. The focus should always be on learning and system improvement, rather than solely on blame. Accurate categorization is the foundation for effective risk management and ensures that resources are directed towards preventing future harm. Question 6. To address the challenge of significant budget constraints, a healthcare organization is considering implementing a new, less expensive vendor for its medical supply chain management. This vendor offers a streamlined ordering and delivery process that promises substantial cost savings. However, the organization's risk management department has raised concerns about the vendor's compliance with healthcare-specific regulations and accreditation standards related to supply chain integrity, product traceability, and the handling of sensitive medical materials. Which approach best balances the need for cost reduction with the imperative of regulatory and accreditation compliance? Option A. Negotiate a contract with the new vendor that prioritizes the lowest possible cost, assuming that regulatory compliance is a standard offering and that accreditation bodies will provide ample time for remediation if any minor issues are discovered. Option B. Conduct a comprehensive due diligence assessment of the potential vendor, specifically evaluating their adherence to relevant healthcare regulations, e.g., FDA requirements for medical devices, HIPAA for any data handling, and accreditation standards, e.g., the Joint Commission Standards on Supply Chain Management and Medication Management. This assessment should include reviewing vendor policies, conducting site visits if feasible, and verifying certifications, followed by a detailed impact analysis of the proposed changes on patient safety, data security, and operational workflows before contract finalization. Option C. Implement the new vendor system for non-critical supplies first to test its reliability and cost-effectiveness, deferring a full assessment of regulatory and accreditation compliance until the system has proven its operational success and cost benefits. Option D. Proceed with the contract for the new vendor immediately to realize the cost savings and address any potential regulatory or accreditation issues that arise after implementation through reactive measures and corrective action plans. Correct answer is B. Conduct a comprehensive due diligence assessment of the potential vendor, specifically evaluating their adherence to relevant healthcare regulations, e.g., FDA requirements for medical devices, HIPAA for any data handling, and accreditation standards, e.g., The Joint Commission Standards on Supply Chain Management and Medication Management. This assessment should include reviewing vendor policies, conducting site visits if feasible, and verifying certifications, followed by a detailed impact analysis of the proposed changes on patient safety, data security, and operational workflows before contract finalization. Explanation. This scenario is professionally challenging because it requires a healthcare organization to balance the immediate need for operational efficiency with the long-term imperative of maintaining compliance with stringent regulatory and accreditation standards. The pressure to reduce costs can inadvertently lead to shortcuts that compromise patient safety and data integrity, thereby increasing the organization's risk profile. Careful judgment is required to ensure that any implemented changes do not violate the spirit or letter of applicable regulations, particularly those enforced by bodies like the Joint Commission in the U.S. healthcare context. The correct approach represents best professional practice because it prioritizes a thorough impact assessment against specific regulatory and accreditation requirements before implementing changes. This proactive stance ensures that potential compliance gaps are identified and addressed early, mitigating the risk of future penalties, adverse survey findings, or loss of accreditation. It aligns with the ethical obligation to provide safe, high-quality care and demonstrates a commitment to continuous improvement as mandated by regulatory frameworks. Specifically, this approach would involve reviewing standards related to patient rights, data security, e.g., HIPAA in the U.S., infection control and quality improvement processes, ensuring that any operational adjustments do not negatively affect these critical areas. An incorrect approach that focuses solely on cost savings without considering regulatory impact is professionally unacceptable. This failure stems from a disregard for the legal and ethical obligations to adhere to established healthcare standards. For instance, implementing a new electronic health record system without verifying its compliance with HIPAA security and privacy rules would expose the organization to significant fines and reputational damage. Similarly, streamlining staffing without ensuring adequate coverage for patient monitoring or emergency response could violate accreditation standards related to patient safety and staffing adequacy, leading to immediate survey deficiencies. Another incorrect approach might involve bypassing established quality control protocols in favor of faster processing, which could compromise the accuracy of patient records or the effectiveness of treatment plans, directly contravening accreditation requirements for quality management and patient outcomes. The professional decision-making process for similar situations should involve a multidisciplinary team, including risk management, compliance officers, legal counsel, and operational leaders. This team should conduct a comprehensive risk assessment, identifying potential impacts on patient safety, data integrity, regulatory compliance, and financial stability. A structured impact assessment framework, which systematically evaluates proposed changes against relevant regulatory mandates and accreditation standards, should be employed. This process should include a review of existing policies and procedures, identification of potential non-compliance areas, development of mitigation strategies, and a plan for ongoing monitoring and evaluation. Question 7. Operational review demonstrates a consistent pattern of delays in the administration of time-sensitive medication to patients in the intensive care unit, leading to documented instances where patients did not receive their prescribed doses within the critical therapeutic windows. Option A. This scenario primarily represents a financial risk due to the potential for increased length of stay and associated costs. Option B. This scenario primarily represents an operational risk due to inefficiencies in staff scheduling and medication dispensing workflows. Option C. This scenario primarily represents a reputational risk due to negative patient feedback and potential for adverse publicity. Option D. This scenario primarily represents a clinical risk due to the direct impact on patient safety and therapeutic outcomes. The correct answer is D. This scenario primarily represents a clinical risk due to the direct impact on patient safety and therapeutic outcomes. Explanation. This scenario presents a common challenge in healthcare risk management, identifying and categorizing risks accurately to ensure appropriate mitigation strategies are implemented. The professional challenge lies in distinguishing between different types of risks, as misclassification can lead to misallocation of resources, ineffective interventions, and potential regulatory noncompliance. Careful judgment is required to understand the root cause and primary impact of each identified issue, The correct approach represents best professional practice because it accurately categorizes the identified issue as a clinical risk. The scenario describes a failure in patient care delivery specifically, a delay in administering a critical medication. This directly impacts patient safety and outcomes, which are hallmarks of clinical risk. Adhering to established clinical protocols and ensuring timely patient care are fundamental to patient safety and are often governed by regulatory bodies like the Centers for Medicare and Medicaid Services, CMS, and accreditation organizations such as the Joint Commission, which mandate adherence to evidence-based practices and patient care standards. An incorrect approach that classifies this as an operational risk would be professionally unacceptable. While operational processes, e.g., staffing, workflow, communication, may have contributed to the delay, the primary and most direct consequence is the compromised patient care. Focusing solely on operational improvements without directly addressing the clinical implications misses the core risk to patient well-being and could lead to a failure to meet clinical quality measures or patient safety goals. This could also lead to regulatory scrutiny if patient harm results, as regulatory bodies prioritize patient safety outcomes. Another incorrect approach that labels this as a financial risk would also be professionally unacceptable. While delays in care can indirectly lead to increased costs, e.g., longer hospital stays, readmissions, malpractice claims, the immediate and primary risk is not financial. Prioritizing financial implications over patient safety is a significant ethical and regulatory failure. Healthcare regulations and ethical guidelines universally place patient safety and quality of care above financial considerations. Finally, classifying this solely as a reputational risk is also professionally unacceptable. While a delay in care can damage an organization's reputation, this is a secondary consequence. The primary risk is the potential for patient harm. Focusing on reputation management without addressing the underlying clinical failure is a superficial approach that fails to protect patients and could lead to repeated incidents. Regulatory bodies are concerned with the actual delivery of safe care, not just the perception of it. The professional decision-making process for similar situations involves a systematic risk assessment. First, identify the event or condition. Second, determine the immediate and primary impact. Is it on patient safety, operational efficiency, financial stability, or organizational reputation? Third, consider the contributing factors and categorize them appropriately. E.g., a workflow issue is operational, but its impact on medication delivery is clinical. Fourth, prioritize mitigation efforts based on the severity and likelihood of harm, with patient safety always taking precedence. Finally, ensure that interventions address the root cause and are aligned with regulatory requirements and best clinical practices. Question 8. Compliance review shows that while the hospital diligently collects incident reports, its primary method for identifying potential patient safety risks relies heavily on these reports, with limited use of proactive audits or staff/patient surveys. Which of the following approaches best represents a comprehensive and effective strategy for identifying healthcare risks within a regulated environment focused on patient safety and quality improvement? Option A. Conducting annual comprehensive audits of all hospital departments to ensure adherence to all regulatory standards and internal policies. Option B. Expanding the incident reporting system to include more detailed fields and providing additional training to staff on the importance of reporting all potential safety events. Option C. Implementing a robust system for analyzing incident reports, conducting regular process audits focused on high-risk areas, and utilizing targeted surveys to gather feedback on patient experience and staff perceptions of safety. Option D. Developing and distributing anonymous surveys to all staff and patients to solicit feedback on any perceived risks or areas for improvement. Correct answer is C. Implementing a robust system for analyzing incident reports, conducting regular process audits focused on high-risk areas, and utilizing targeted surveys to gather feedback on patient experience and staff perceptions of safety. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare risk management, ensuring the effectiveness and comprehensiveness of risk identification methods. The organization has implemented several approaches, but the compliance review suggests a potential gap or inefficiency. The professional challenge lies in evaluating the relative strengths and weaknesses of each method in the context of the Certified Professional in Healthcare Risk Management (CPHRM) domain, which emphasizes proactive identification and mitigation of risks to patient safety and organizational integrity. Determining the most effective approach requires understanding how each method contributes to a holistic risk profile and aligns with regulatory expectations for quality improvement and patient safety. Correct approach analysis. The most effective approach to risk identification in this scenario is a multifaceted strategy that integrates data from various sources. Incident reports provide a reactive view of actual harms or near misses, offering concrete examples of failures. Audits, particularly those focused on processes and compliance, offer a proactive and systematic evaluation of adherence to established standards and protocols, identifying potential vulnerabilities before they manifest as incidents. Surveys, when well-designed and targeted, can capture perceptions and experiences of staff and patients, uncovering systemic issues or latent risks that might not be evident through other methods. Combining these approaches allows for triangulation of data, providing a more robust and nuanced understanding of the risk landscape. This aligns with best practices in risk management, which advocate for a layered approach to ensure that no single method's limitations create blind spots. Regulatory frameworks, such as those underpinning HIPAA and the Affordable Care Act, though not explicitly stated as the jurisdiction, CPHRM implies U.S. context, emphasize a commitment to continuous quality improvement and patient safety, which necessitates comprehensive risk identification. Incorrect approaches analysis, relying solely on incident reports, while crucial, is insufficient. This method is reactive and dependent on staff reporting, which can be influenced by fear of reprisal or a lack of awareness. It may miss systemic issues or risks that have not yet resulted in a reportable event. This failure to proactively identify risks can lead to noncompliance with quality improvement mandates. Focusing exclusively on audits, while systematic, can be narrowly focused on compliance with specific regulations or policies. Audits may not capture the full spectrum of patient experience or emergent risks that fall outside the audit's predefined scope. This can lead to a false sense of security if the audit criteria are not comprehensive enough to identify all potential hazards. Depending solely on surveys, especially if they are not rigorously designed or analyzed, can yield subjective data that is difficult to quantify or act upon. Poorly constructed surveys may not elicit accurate or relevant information, leading to misidentification of risks or an overemphasis on minor issues while overlooking significant ones. This can hinder effective resource allocation for risk mitigation. Professional reasoning. Professionals should adopt a systematic and integrated approach to risk identification. This involves 1. Understanding the organization's specific risk profile and regulatory environment. 2. Selecting a combination of risk identification methods that are complementary and address different facets of risk, e.g., reactive, proactive, perceptual. 3. Ensuring that each method is well designed, implemented, and analyzed. 4. Establishing clear processes for data aggregation, analysis, and prioritization of identified risks. 5. Regularly reviewing and refining the risk identification strategy based on its effectiveness and evolving organizational needs and regulatory landscapes. This approach ensures a comprehensive understanding of risks, enabling effective mitigation strategies, and fostering a culture of safety and continuous improvement, which is a core tenet of healthcare risk management. Question 9. The assessment process reveals a series of potential risks within a healthcare facility, ranging from medication errors to data breaches. To effectively prioritize mitigation efforts, which of the following approaches to risk analysis is most crucial for understanding the potential severity of these events on patient safety and organizational integrity? Option A. Focusing solely on the ease of implementing corrective actions. Option B. Evaluating the potential severity of consequences for each identified risk. Option C. Gathering anecdotal evidence from staff about perceived risks. Option D. Documenting the historical frequency of similar incidents. The correct answer is B. Evaluating the potential severity of consequences for each identified risk. Explanation. The assessment process reveals a critical need to evaluate the potential impact of identified risks on patient safety and organizational operations. This scenario is professionally challenging because it requires a nuanced understanding of how to translate theoretical risk identification into actionable insights that prioritize mitigation efforts. The judgment required lies in selecting a methodology that accurately reflects the severity and likelihood of harm, ensuring that resources are allocated effectively to address the most significant threats. The correct approach represents best professional practice because it directly aligns with the core principles of healthcare risk management, emphasizing a systematic and objective evaluation of potential consequences. This methodology, focusing on impact assessment, allows for a clear understanding of the severity of potential adverse events, whether they manifest as patient harm, financial loss, reputational damage, or regulatory noncompliance. By quantifying or qualitatively assessing the magnitude of these potential impacts, healthcare organizations can prioritize risks based on their potential to cause significant harm, thereby guiding the development of targeted and effective risk mitigation strategies. This aligns with regulatory expectations for proactive risk management and patient safety initiatives, as mandated by bodies overseeing healthcare quality and compliance. An incorrect approach that solely focuses on the frequency of a risk without considering its potential severity fails to adequately address the most critical threats. This is a regulatory and ethical failure because it can lead to a misallocation of resources, where common but low-impact risks receive undue attention, while rare but catastrophic events are overlooked. This directly compromises patient safety and organizational stability. Another incorrect approach that relies on subjective opinions without a structured framework for assessing impact is also professionally unacceptable. This leads to inconsistent and biased risk evaluations, making it difficult to justify mitigation decisions and potentially overlooking significant risks due to personal biases or incomplete information. This violates ethical obligations to provide objective and evidence-based risk management. The professional decision-making process for similar situations should involve a structured approach to risk assessment. First, clearly define the scope of the risk assessment and the criteria for evaluating impact. Second, gather relevant data and information to inform the assessment. Third, apply a chosen methodology, such as impact assessment, to systematically evaluate the potential consequences of each identified risk. Fourth, prioritize risks based on the assessment findings, considering both likelihood and impact. Finally, develop and implement appropriate mitigation strategies, continuously monitoring their effectiveness and reassessing risks as needed. This systematic process ensures that risk management efforts are data-driven, objective, and aligned with organizational goals and regulatory requirements. Question 10. Consider a scenario where a healthcare organization is implementing a new risk management initiative to proactively identify potential patient safety events by analyzing trends within its electronic health records, EHR. The risk management team proposes to use sophisticated data analytics tools to sift through vast amounts of patient data. Which of the following approaches best balances the need for effective risk identification with the regulatory requirements for patient privacy under U.S. federal law? Option A. Implement a system that allows risk managers to view and analyze all patient demographic and clinical information in real time, flagging any unusual entries for further investigation. Option B. Rely exclusively on manual chart reviews and incident reports, as these methods are less likely to involve the direct use of electronic patient data and thus pose fewer privacy concerns. Option C. Access and review individual patient charts directly within the EHR system, focusing on specific diagnoses and treatment pathways to identify deviations from best practices. Option D. Conduct a comprehensive analysis of de-identified and aggregated EHR data to identify patterns and anomalies indicative of potential risks, while ensuring that no individual patient can be re-identified. The correct answer is D. Conduct a comprehensive analysis of de-identified and aggregated EHR data to identify patterns and anomalies indicative of potential risks, while ensuring that no individual patient can be re-identified. Explanation. This scenario presents a common challenge in healthcare risk management, leveraging advanced technology for risk identification while ensuring compliance with stringent privacy regulations. The professional challenge lies in balancing the potential benefits of data analytics from electronic health records, EHR, for proactive risk detection against the imperative to protect protected health information, FI, as mandated by the Health Insurance Portability and Accountability Act, HIPAA. Careful judgment is required to implement effective risk management strategies without inadvertently violating patient privacy rights or data security standards. The correct approach involves utilizing de-identified or aggregated data for trend analysis, which aligns with HIPAA privacy rule. This allows for the identification of systemic risks, such as patterns in adverse drug events or hospital-acquired infections, without exposing individual patient data. This method represents best professional practice because it directly addresses the core risk management objective of proactive identification and mitigation, while adhering to the legal and ethical obligations to safeguard PHI. The use of de-identified data is a recognized and permissible method under HIPAA for research and analysis, enabling risk managers to glean valuable insights without compromising patient confidentiality. An incorrect approach would be to directly analyze individual patient records within the EHR for risk identification without proper authorization or de-identification. This constitutes a direct violation of HIPAA privacy rule, specifically the provisions regarding the use and disclosure of PHI. Ethically, it breaches patient trust and the fundamental right to privacy. Another incorrect approach would be to rely solely on manual chart reviews for risk identification, ignoring the potential of EHR data analytics. While manual reviews are a valid risk identification tool, neglecting the advanced capabilities of EHRs for data-driven insights represents a failure in due diligence and a missed opportunity for more comprehensive and efficient risk management, potentially leading to a failure to identify emerging risks in a timely manner. Professionals should employ a decision-making framework that prioritizes regulatory compliance and ethical considerations. This involves understanding the specific requirements of HIPAA, including the definitions of PHI, permitted uses and disclosures, and the standards for de-identification. When considering the use of technology for risk identification, the process should include a thorough risk assessment of the proposed data usage, consultation with legal and compliance departments, and the implementation of robust data security measures. The decision should always favor methods that maximize risk identification potential while minimizing the risk of privacy breaches. Question 11. The investigation demonstrates that a medication error occurred due to a combination of inadequate staff training on a new electronic health record, EHR, systems medication ordering module, and a lack of clear protocols for verifying medication orders during off-hours. Which of the following represents the most effective and compliant approach to developing and implementing corrective actions? Option A. Develop a comprehensive training program for all nursing and pharmacy staff on the EHR medication module. Revise the off-hours medication verification protocol to include a mandatory second check by a pharmacist or designated senior nurse, and establish a quarterly review of medication error reports related to the EHR to assess the effectiveness of these interventions. Option B. Allocate budget for a system-wide upgrade of the EHR's medication module, deferring specific staff training and protocol revisions until the upgrade is complete, which is anticipated in 18 months. Option C. Post a memo to all departments outlining the importance of careful medication order verification and schedule a general staff meeting in 6 months to discuss any ongoing issues. Option D. Immediately implement mandatory retraining for all staff on the existing medication administration policies, assuming the EHR system is functioning as intended and the issue lies solely with user adherence. The correct answer is A. Develop a comprehensive training program for all nursing and pharmacy staff on the EHR medication module. Revise the off-hours medication verification protocol to include a mandatory second check by a pharmacist or designated senior nurse, and establish a quarterly review of medication error reports related to the EHR to assess the effectiveness of these interventions. Explanation. This scenario presents a common challenge in healthcare risk management, translating a thorough root cause analysis, RCA, into effective, sustainable corrective actions that address systemic issues rather than just superficial symptoms. The difficulty lies in moving beyond identifying the what and how of an adverse event to implementing meaningful changes that prevent recurrence, often requiring significant organizational buy-in, resource allocation, and cultural shifts. The correct approach represents best professional practice because it directly links the RCA findings to specific, measurable, achievable, relevant, and time-bound, SMART actions. This ensures that the corrective plan is not merely a list of good intentions but a concrete strategy for improvement. It prioritizes actions that address the identified root causes, involve relevant stakeholders in implementation and monitoring, and establish mechanisms for ongoing evaluation of effectiveness. This aligns with the principles of continuous quality improvement and patient safety mandated by regulatory bodies overseeing healthcare organizations, such as the Centers for Medicare and Medicaid Services, CMS, in the U.S., which emphasize proactive risk identification and mitigation. An incorrect approach that focuses solely on retraining staff without addressing underlying system vulnerabilities fails to meet regulatory expectations for comprehensive risk management. Such an approach often represents a superficial fix that does not prevent future occurrences because the systemic issues that contributed to the event remain unaddressed. This could lead to regulatory scrutiny and potential penalties for non-compliance with patient safety standards. Another incorrect approach that involves delaying implementation of corrective actions due to resource constraints. Without a clear plan for overcoming these barriers or prioritizing critical safety interventions, demonstrates a failure to uphold the ethical obligation to protect patient well-being. Regulatory frameworks often require timely remediation of identified risks, and prolonged delays can be interpreted as a disregard for patient safety, potentially leading to adverse outcomes and regulatory sanctions. A third incorrect approach that involves implementing corrective actions that are not directly linked to the identified root causes of the adverse event is inefficient and ineffective. This approach wastes resources and fails to achieve the intended goal of preventing recurrence. It also signals a lack of rigorous analytical thinking in the RCA process and a failure to translate findings into actionable strategies, which is a core competency expected of healthcare risk management professionals. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review and validate the RCA findings to ensure all contributing factors have been identified. 2. Prioritize corrective actions based on their potential impact on patient safety and their direct relevance to the identified root causes. 3. Develop smart action plans, assigning clear responsibilities and timelines. 4. Engage relevant stakeholders in the development and implementation of corrective actions to foster ownership and ensure feasibility. 5. Establish robust monitoring and evaluation mechanisms to track the effectiveness of implemented actions and make necessary adjustments. 6. Ensure compliance with all applicable federal and state regulations related to patient safety and quality improvement. Question 12. Upon reviewing recent patient safety data indicating an increase in medication errors during patient handoffs, a healthcare organization is considering implementing new standardized checklists and protocols to mitigate this risk. A risk manager is tasked with proposing the most effective strategy for introducing these interventions to the medical staff, which approach best balances regulatory compliance, ethical consideration, and practical implementation for improving patient safety. Option A. Mandate the immediate adoption of a pre-existing, widely recognized checklist for all patient handoffs, with a clear policy outlining disciplinary actions for noncompliance. Option B. Delegate the sole responsibility for creating and enforcing new handoff protocols to the pharmacy department, with minimal direct physician involvement in the development phase. Option C. Implement a pilot program for the new checklists in a single unit, with the expectation that successful outcomes will naturally encourage broader adoption by other departments. Option D. Propose a phased implementation of evidence-based checklists and protocols, developed collaboratively with physician input, accompanied by comprehensive education on their rationale and benefits, and a system for ongoing feedback and refinement. The correct answer is D. Propose a phased implementation of evidence-based checklists and protocols, developed collaboratively with physician input, accompanied by comprehensive education on their rationale and benefits, and a system for ongoing feedback and refinement. Explanation. This scenario presents a common challenge in healthcare risk management, balancing the implementation of standardized safety protocols with the need for clinical flexibility and physician autonomy. The professional challenge lies in ensuring that evidence-based strategies, such as checklists and protocols, are adopted effectively without alienating the very professionals whose buy-in is crucial for their success. Careful judgment is required to select an approach that fosters collaboration and addresses potential resistance, while upholding the organization's commitment to patient safety and regulatory compliance. The correct approach represents best professional practice because it prioritizes a collaborative and educational strategy. Engaging physicians early in the development and refinement of checklists and protocols, and providing robust education on their rationale and benefits aligns with principles of shared governance and evidence-based practice. This approach respects physician expertise while reinforcing the organization's commitment to patient safety, which is a core tenet of healthcare regulation and ethical practice. It also promotes a culture of safety where staff feel empowered to contribute to process improvement. An incorrect approach that focuses solely on mandatory implementation without physician input fails to acknowledge the importance of clinical buy-in and can lead to superficial compliance or workarounds, undermining the intended safety benefits. This can create ethical issues related to professional respect and may indirectly violate regulatory expectations for effective quality improvement initiatives, which often implicitly require staff engagement. Another incorrect approach that relies on punitive measures for non-compliance is counterproductive to fostering a culture of safety. While accountability is important, a punitive approach can breed fear and discourage open reporting of errors or near misses, which are vital for learning and improvement. This can create a regulatory risk by hindering the organization's ability to identify and address systemic issues, and it is ethically problematic as it does not support a learning environment. A third incorrect approach that delegates the entire responsibility for protocol development and implementation to a single department without broader stakeholder engagement risks creating protocols that are impractical or not well integrated into clinical workflows. This can lead to inefficiencies and potential patient safety risks if the protocols are not aligned with the realities of patient care and may not meet the comprehensive requirements of regulatory bodies focused on system-wide safety improvements. The professional decision-making process for similar situations should involve a systematic approach. First, identify the specific patient safety risk and the relevant evidence-based interventions, checklists, protocols. Second, engage key stakeholders, particularly frontline clinicians, in the design and refinement of these interventions, ensuring they are practical and address clinical realities. Third, develop a comprehensive education and training plan that explains the rationale, benefits, and proper use of the new strategies. Fourth, establish clear metrics for monitoring adherence and effectiveness, and create a feedback loop for continuous improvement. Finally, ensure that accountability mechanisms are fair, transparent, and focused on learning and system improvement rather than solely on individual blame. Question 13. Cost-benefit analysis shows that implementing a new, evidence-based safety protocol for medication administration would incur significant upfront costs for training and new equipment, potentially outweighing the projected savings from reduced medication errors in the short term. However, the absence of this protocol leaves patients at a demonstrably higher risk of preventable adverse drug events, which could lead to extended hospital stays, increased treatment costs, and potential litigation. As the risk manager, what is the most appropriate course of action? Option A. Advocate for the immediate implementation of the safety protocol, emphasizing the ethical imperative to protect patients from preventable harm and the long-term financial and reputational benefits of robust risk management, even if initial financial projections are less favorable. Option B. Prioritize the financial implications and recommend against implementing the new protocol, suggesting that the organization focus its resources on other areas with more immediate and quantifiable financial returns. Option C. Defer the decision until further cost-benefit analyses can be conducted, focusing on identifying less expensive alternatives that might offer similar, albeit potentially less effective, risk reduction. Option D. Proceed with the current medication administration procedures, as the cost-benefit analysis does not definitively prove that the new protocol will yield a net financial gain in the immediate future. The correct answer is A. Advocate for the immediate implementation of the safety protocol, emphasizing the ethical imperative to protect patients from preventable harm and the long-term financial and reputational benefits of robust risk management, even if initial financial projections are less favorable. Explanation. This scenario presents a common ethical dilemma in healthcare risk management, where financial considerations clash with patient safety and regulatory compliance. The challenge lies in balancing the immediate costs of implementing a safety measure against the potential long-term costs of adverse events, including financial penalties, reputational damage, and most importantly, patient harm. A robust risk management program, as mandated by healthcare regulations, prioritizes patient well-being and adherence to standards over purely economic expediency. The correct approach prioritizes patient safety and regulatory compliance by advocating for the implementation of the safety measure, even if the initial cost-benefit analysis appears unfavorable from a purely financial perspective. This aligns with the fundamental ethical principles of beneficence and non-maleficence, as well as the legal and regulatory duty of care owed to patients. Healthcare organizations are expected to proactively identify and mitigate risks to prevent harm, and this proactive stance is often a regulatory requirement. Investing in safety measures, even with a less favorable short-term financial outlook, is a demonstration of a commitment to quality care and risk reduction, which ultimately leads to better patient outcomes and a more sustainable healthcare system. An incorrect approach that solely focuses on the immediate financial savings, ignoring the potential for patient harm and regulatory noncompliance, represents a significant ethical and professional failure. This approach violates the principle of non-maleficence by potentially exposing patients to preventable harm. It also disregards the organization's legal and regulatory obligations to maintain a safe environment and implement appropriate risk mitigation strategies. Such a decision could lead to severe consequences, including sentinel events, regulatory sanctions, lawsuits, and a loss of public trust. Another incorrect approach might involve delaying implementation based on incomplete data or a desire for further analysis without a clear plan for immediate risk mitigation, which still exposes patients to undue risk. This demonstrates a lack of urgency and a failure to adequately prioritize patient safety when a known risk exists. Professionals should employ a decision-making framework that integrates ethical considerations, regulatory requirements, and a comprehensive understanding of risk. This involves moving beyond simple financial cost-benefit analyses to include the cost of potential harm, the likelihood of adverse events, and the organization's ethical and legal obligations. When faced with such dilemmas, risk managers should advocate for a holistic approach that prioritizes patient safety and compliance, seeking to identify solutions that achieve both safety and financial sustainability in the long term. This often involves engaging stakeholders, exploring alternative solutions, and escalating concerns when necessary to ensure the highest standards of care are maintained. Question 14. Examination of the data shows a consistent pattern of near-miss events related to medication administration, with a lower but still present occurrence of adverse drug events. When developing a risk heat map, which of the following approaches best prioritizes these risks for immediate mitigation efforts? Option A. Categorizing risks based on the ease with which they can be addressed, prioritizing those that require minimal resources for resolution. Option B. Plotting risks based on a combination of the severity of potential patient harm and the likelihood of occurrence, with a focus on those falling into the high severity/high likelihood quadrant. Option C. Prioritizing risks solely based on the number of reported near-miss events, as this indicates the highest frequency of potential issues. Option D. Focusing exclusively on risks that have resulted in the most significant financial penalties or claims in the past fiscal year. The correct answer is B. Plotting risks based on a combination of the severity of potential patient harm and the likelihood of occurrence, with a focus on those falling into the high severity/high likelihood quadrant. Explanation: this scenario is professionally challenging because it requires a healthcare risk manager to move beyond simply identifying risks to strategically prioritizing them based on their potential impact and likelihood, using a visual tool like a heat map. The challenge lies in the subjective nature of impact assessment and the need to align this assessment with organizational goals and regulatory expectations, ensuring that resources are allocated to mitigate the most significant threats to patient safety and organizational viability. Careful judgment is required to avoid biases and ensure the heat map accurately reflects the true risk landscape. The correct approach represents best professional practice because it directly addresses the core function of risk mapping, to visually represent and prioritize risks. By categorizing potential impacts, e.g., patient harm, financial loss, reputational damage, and likelihood, and then plotting these on a matrix, the organization gains a clear, actionable understanding of its highest priority risks. This aligns with the principles of proactive risk management, which is a cornerstone of healthcare quality and safety initiatives, and implicitly supports compliance with regulations that mandate risk assessment and mitigation, such as those overseen by CMS or Joint Commission standards that emphasize patient safety and quality improvement. An incorrect approach that focuses solely on the frequency of an event without considering its potential severity fails to provide a comprehensive risk picture. This is a regulatory and ethical failure because it can lead to underestimation of critical risks that, while perhaps infrequent, could have catastrophic consequences. For example, a rare but severe adverse event might be overlooked if only frequency is considered, violating the ethical imperative to protect patients from harm and potentially failing to meet regulatory requirements for identifying and mitigating all significant risks. Another incorrect approach that prioritizes risks based on anecdotal evidence or personal opinions rather than systematic data analysis is also professionally unacceptable. This represents a failure in due diligence and professional accountability. Ethically, it compromises the integrity of the risk management process, potentially leading to misallocation of resources and a false sense of security. From a regulatory standpoint, it demonstrates a lack of adherence to established risk management methodologies and could be seen as a failure to implement a robust quality assessment and performance improvement program, which is often a regulatory expectation. A third incorrect approach that exclusively focuses on risks with the highest financial impact, neglecting patient safety or operational risks, is also flawed. While financial implications are important, healthcare risk management's primary ethical and often regulatory mandate is patient safety. Overlooking patient harm in favor of financial considerations is a significant ethical breach and can lead to regulatory scrutiny and penalties for failing to adequately address patient care quality and safety. The professional reasoning process for similar situations should involve a systematic approach. 1. Identify all potential risks relevant to the healthcare setting. 2. Define clear criteria for assessing the likelihood and impact of each risk, ensuring these criteria are objective and measurable where possible. 3. Gather relevant data to inform the assessment of likelihood and impact. 4. Utilize a risk matrix or heat map to visually plot and categorize risks based on their assessed scores. 5. Engage relevant stakeholders in the review and validation of the risk map to ensure consensus and buy-in. 6. Develop and implement targeted mitigation strategies for high-priority risks, and regularly review and update the risk map to reflect changes in the risk landscape. Question 15. The evaluation methodology shows that the healthcare organization's current risk management processes are fragmented, with different departments employing disparate methods for identifying and addressing potential issues. Leadership is seeking to implement a more cohesive and effective approach. Which of the following strategies best aligns with established risk management frameworks and regulatory expectations for healthcare organizations? Option A. Adopt a comprehensive, internationally recognized risk management framework, e.g., ISO 31000 or CPHRM, and tailor its principles to the specific healthcare context, ensuring integration across all organizational functions and a focus on patient safety and quality improvement. Option B. Enhance the existing incident reporting system to capture more detailed information about adverse events, relying on the analysis of these reports to identify and address risks as they arise. Option C. Empower individual department managers to develop and implement their own risk management protocols based on their specific departmental needs and perceived risks, fostering autonomy and localized expertise. Option D. Prioritize the development of financial risk mitigation strategies, as these are perceived to have the most significant impact on the organization's bottom line and overall stability. The correct answer is A. Adopt a comprehensive, internationally recognized risk management framework, e.g., ISO 31000 or CPHRM, and tailor its principles to the specific healthcare context, ensuring integration across all organizational functions and a focus on patient safety and quality improvement. Explanation. The evaluation methodology shows a healthcare organization is struggling to consistently identify and mitigate risks across its various departments. This scenario is professionally challenging because effective risk management is foundational to patient safety, regulatory compliance, and organizational sustainability. The complexity arises from the need to integrate risk management principles into daily operations, ensuring that all staff understand their roles and responsibilities in risk identification and reporting, and that leadership actively supports and champions these efforts. Careful judgment is required to select a framework that is adaptable, comprehensive, and aligns with the organization's specific needs and the regulatory landscape. The correct approach represents best professional practice because it involves selecting and implementing a recognized risk management framework, such as ISO 31000 or CPHRM, tailored to the healthcare environment. These frameworks provide a structured, systematic process for risk identification, analysis, evaluation, treatment, and monitoring. Their adoption ensures a consistent, proactive, and integrated approach to risk management, which is essential for meeting the requirements of healthcare regulations and standards aimed at patient safety and quality of care. This systematic approach facilitates continuous improvement and demonstrates due diligence in managing potential harm. An incorrect approach that focuses solely on reactive incident reporting without a proactive framework fails to meet professional standards. This is because it neglects the crucial steps of risk identification and analysis before an incident occurs, leading to a reactive rather than a preventative stance. Such an approach may violate regulatory mandates that require organizations to have robust systems for identifying and mitigating risks to patient safety. Another incorrect approach that prioritizes financial risk over clinical risk is professionally unacceptable. Healthcare risk management must encompass all types of risks, with a primary focus on patient safety and clinical outcomes, as mandated by healthcare regulations. Overlooking clinical risks can lead to patient harm, adverse events, and significant legal and reputational damage, directly contravening the ethical obligations and regulatory expectations of healthcare providers. A third incorrect approach that relies on anecdotal evidence and individual staff intuition for risk assessment, rather than a structured methodology, is also professionally flawed. This method lacks objectivity, consistency, and the ability to aggregate and analyze risks systematically. It fails to provide the comprehensive oversight required by regulatory bodies, and can lead to the overlooking of systemic issues that pose significant threats to patient care and organizational integrity. Professionals should employ a decision-making framework that begins with understanding the organization's strategic objectives and the specific regulatory environment, e.g., HIPAA, CMS regulations in the U.S. This involves assessing the current state of risk management practices, identifying gaps, and then evaluating various risk management frameworks for their suitability. The chosen framework should be adaptable, scalable, and promote a culture of safety and continuous improvement. Implementation should involve stakeholder engagement, training, and clear communication of roles and responsibilities, with ongoing monitoring and evaluation to ensure effectiveness and compliance. Question 16. System analysis indicates that a newly implemented electronic health record (EHR) alert system, designed to flag potential drug-drug interactions, is generating a high volume of false positives for a specific common medication combination. A seasoned nurse observes that these frequent, non-critical alerts are causing significant distraction and increasing the likelihood that a genuinely critical alert might be overlooked by busy clinicians. The nurse is concerned this could lead to a patient safety event. What is the most appropriate immediate action for the nurse to take? Option A. Continue to follow the EHR alert system as implemented, assuming the system developers have accounted for all potential issues and that the alerts, even if frequent, are intended to be followed. Option B. Override the new EHR alert system for the specific medication combination in question and revert to the previous manual check process to ensure patient safety. Option C. Discuss the issue with other nurses on the unit to see if they are experiencing similar problems, but refrain from formal reporting until a consensus is reached among the nursing staff. Option D. Immediately report the observed pattern of false positive alerts and the potential patient safety risk to the hospital's Patient Safety Committee and the IT department responsible for the EHR system. The correct answer is D. Immediately report the observed pattern of false positive alerts and the potential patient safety risk to the hospital's Patient Safety Committee and the IT department responsible for the EHR system. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a healthcare professional's immediate clinical judgment and a newly implemented organizational policy designed to enhance patient safety. The challenge lies in balancing the need for adherence to established protocols with the imperative to act in the patient's best interest when those protocols may inadvertently create risk. The healthcare professional must navigate potential consequences, including patient harm, professional reprimand, and organizational repercussions, while making a critical decision under pressure. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and ethical responsibility above strict, potentially flawed policy adherence. By immediately reporting the observed discrepancy and potential risk to the appropriate oversight body, the Patient Safety Committee, the professional is fulfilling their duty to advocate for the patient and contribute to systemic improvement. This aligns with the core principles of healthcare risk management, which emphasize proactive identification and mitigation of risks. Specifically, under U.S. healthcare regulations and professional ethical codes, healthcare professionals have a legal and ethical obligation to report patient safety concerns and to act in a manner that prevents harm. This proactive reporting allows for timely review, potential policy revision, and immediate intervention if necessary, thereby protecting current and future patients. Incorrect approaches analysis. One incorrect approach involves disregarding the new policy and proceeding with the previous practice without any communication. This is professionally unacceptable because it bypasses established organizational safety protocols, even if perceived as flawed. It creates a risk of inconsistent care, undermines the authority of the policymaking body, and fails to contribute to the learning and improvement process. Ethically, it represents a failure to collaborate and a potential breach of professional responsibility to follow organizational guidelines designed for patient safety. Another incorrect approach is to ignore the discrepancy and continue with the new policy as written, despite recognizing a potential patient safety risk. This is a significant ethical and regulatory failure. It demonstrates a lack of critical thinking and patient advocacy. Healthcare professionals are expected to exercise professional judgment and to question or report practices that may jeopardize patient well-being. Failing to do so can lead to patient harm and potential legal liability, as it indicates a dereliction of duty to ensure safe patient care. A third incorrect approach is to discuss the discrepancy only with colleagues without formally reporting it. While collegial discussion can be valuable, it is insufficient when a patient safety risk is identified. This approach fails to engage the formal mechanisms for addressing systemic issues and can lead to a diffusion of responsibility. It does not guarantee that the issue will be escalated to those with the authority to implement changes or to provide immediate patient-specific interventions, thus leaving the patient vulnerable and the organization unaware of a critical risk. Professional reasoning. Professionals should employ a decision-making framework that begins with identifying the potential risk to patient safety. This involves critically evaluating existing protocols against clinical experience and patient needs. The next step is to determine the most effective and timely method for addressing the identified risk. This typically involves escalating the concern through appropriate channels, such as a patient safety committee or a direct supervisor, while simultaneously ensuring the immediate safety of the patient. Documentation of observations and actions taken is crucial. This process emphasizes a commitment to continuous improvement, patient advocacy, and adherence to both regulatory requirements and ethical obligations within the healthcare system. Question 17. Analysis of a healthcare organization's response to a data breach involving electronic protected health information, EFI, that was inadvertently transmitted to an unauthorized external party due to a misconfigured email server. The organization must determine the primary regulatory framework to guide its immediate actions, including notification and mitigation efforts. Option A, the Health Insurance Portability and Accountability Act, HIPAA. Option B, the Centers for Medicare and Medicaid Services, CMS, Conditions of Participation. Option C, the Occupational Safety and Health Administration, OSHA, Standards. Option D, a combined approach equally prioritizing all three regulatory bodies from the outset. The correct answer is A, the Health Insurance Portability and Accountability Act, HIPAA. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare risk management where multiple federal regulations, each with distinct purposes and scopes, intersect. The difficulty lies in accurately identifying which regulations' requirements are paramount when a single event or practice potentially implicates all of them. Healthcare organization must navigate these overlapping mandates to ensure compliance, protect patient safety, and avoid significant penalties. The professional challenge is to prioritize and integrate these regulatory frameworks effectively. Correct approach analysis. The correct approach prioritizes the Health Insurance Portability and Accountability Act, HIPAA, when the core issue involves the privacy and security of protected health information. 5. HIPAA privacy and security rules are specifically designed to govern how PHI is handled, stored, transmitted, and protected. While OSHA addresses workplace safety and CMS deals with payment and quality of care, HIPAA is the definitive regulation for breaches of patient data. Therefore, focusing on HIPAA breach notification requirements and mitigation strategies is the most appropriate initial response. Incorrect approach is analysis, an approach that solely focuses on occupational safety and health administration, OSHA. Regulations would be incorrect because OSHA's primary concern is the safety and health of employees in the workplace. While an incident involving PHI might have workplace safety implications, OSHA does not directly govern the privacy or security of patient data itself. An approach that exclusively considers Centers for Medicare and Medicaid Services, CMS, regulations would also be incorrect. CMS regulations are primarily concerned with the conditions of participation for healthcare providers receiving Medicare and Medicaid funding, including quality of care and payment integrity. While CMS has an interest in data security as it relates to billing and patient care, it does not have the same comprehensive mandate over PHI privacy and security as HIPAA. An approach that attempts to address all three regulations equally without prioritizing the most directly applicable one would be inefficient and potentially lead to misapplication of requirements. While all three regulations may be relevant to a healthcare organization's operations, the specific nature of a PHI breach demands an immediate and primary focus on HIPAA. Professional reasoning. When faced with a situation potentially implicating multiple federal regulations, a risk manager should first identify the primary nature of the incident. If the incident directly involves the unauthorized access, use, or disclosure of PHI, HIPAA is the governing regulation. The organization must then assess the scope of the breach under HIPAA, implement required notification procedures, and take steps to mitigate harm. Concurrently, the risk manager should evaluate if OSHA or CMS regulations are also triggered by the incident, e.g., if the breach was caused by a workplace safety failure or impacts billing processes, and address those requirements as secondary or parallel obligations. This tiered approach ensures the most critical regulatory obligations are met first. Question 18. Compliance review shows a recurring pattern of medication errors related to a specific high-alert medication due to a complex administration process. The risk management team has identified this as a significant patient safety concern requiring immediate intervention. Option A. File a detailed incident report for each error and await further instructions from the pharmacy department on how to proceed. Option B. Introduce a new, more expensive alternative medication that has a lower risk profile, without a comprehensive analysis of the current process's failures. Option C. Implement a multidisciplinary team to conduct a thorough root cause analysis of the medication errors, identify contributing factors in the administration process, and develop evidence-based recommendations for process redesign and staff education to mitigate the risk. Option D. Issue a formal reprimand to all nursing staff involved in the recent medication errors to emphasize the seriousness of the issue and deter future occurrences. The correct answer is C. Implement a multidisciplinary team to conduct a thorough root cause analysis of the medication errors, identify contributing factors in the administration process, and develop evidence-based recommendations for process redesign and staff education to mitigate the risk. Explanation. The scenario presents a common challenge in healthcare risk management, balancing the need for efficient patient care with the imperative to implement robust risk reduction strategies. The professional challenge lies in identifying the most effective and compliant method for addressing an identified risk, ensuring that the chosen approach aligns with regulatory mandates and ethical obligations without introducing new vulnerabilities. Careful judgment is required to select a technique that is not only theoretically sound, but also practically implementable within the healthcare setting and demonstrably effective in mitigating the specific risk. The correct approach represents best professional practice because it directly addresses the root cause of the identified risk through a systematic and evidence-based process. This aligns with the principles of proactive risk management mandated by regulatory frameworks such as those governing healthcare quality and patient safety. By focusing on improving the process itself, the organization demonstrates a commitment to continuous improvement and a dedication to preventing future adverse events, which is a core tenet of healthcare risk management and a key expectation of regulatory bodies. This approach is also ethically sound as it prioritizes patient well-being and safety. An incorrect approach that focuses solely on disciplinary action for individuals involved fails to address the systemic issues that likely contributed to the risk. This is a regulatory and ethical failure because it shifts blame without implementing corrective actions to prevent recurrence, potentially leading to repeated incidents. It also fosters a punitive environment, discouraging open reporting of errors and near misses, which is counterproductive to effective risk management and violates principles of a just culture. Another incorrect approach that involves simply documenting the incident without implementing any corrective actions is a significant regulatory and ethical failure. This passive approach demonstrates a lack of commitment to risk mitigation and patient safety. Regulatory bodies expect healthcare organizations to not only identify risks, but also to actively implement strategies to reduce them. Failing to do so can result in noncompliance, penalties, and a continued exposure of patients to harm. Ethically, it represents a dereliction of duty to protect patients. A third incorrect approach that involves implementing a superficial change without a thorough root cause analysis is also professionally unacceptable. This approach may appear to address the risk, but fails to identify and rectify the underlying systemic causes. This can lead to the risk re-emerging in a different form or at a later time, representing a failure in due diligence and a potential violation of regulatory requirements for effective quality improvement and risk management programs. It is ethically problematic as it does not genuinely safeguard patient interests. The professional decision-making process for similar situations should involve a structured approach. First, thoroughly investigate the incident to understand its root causes. Second, evaluate potential risk reduction techniques based on their effectiveness, feasibility, and regulatory compliance. Third, implement the chosen technique with clear protocols and training. And finally, monitor the effectiveness of the implemented technique and make adjustments as necessary. This iterative process ensures that risk management efforts are comprehensive, compliant, and contribute to a safer healthcare environment. Question 19. Market research demonstrates that healthcare organizations often struggle with achieving optimal engagement in their incident reporting systems. Considering the paramount importance of these systems for identifying and mitigating patient safety risks, which of the following stakeholder engagement strategies is most likely to foster a robust and effective reporting culture, thereby fulfilling regulatory expectations for patient safety improvement? Option A. Focusing reporting efforts exclusively on events that result in significant patient harm, as these are the most critical for regulatory compliance. Option B. Encouraging staff to report only when they are certain an individual error has occurred to maintain the accuracy and focus of the data collected. Option C. Implementing a system that automatically flags all reported incidents for immediate review by a dedicated compliance officer to ensure all potential policy violations are addressed. Option D. Emphasizing the system's role in identifying trends and system vulnerabilities for proactive improvement, coupled with clear communication that reports are primarily for learning and system enhancement, not punitive action against individuals. The correct answer is D. Emphasizing the system's role in identifying trends and system vulnerabilities for proactive improvement, coupled with clear communication that reports are primarily for learning and system enhancement, not punitive action against individuals. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate need for data collection with the long-term implications of how that data is perceived and utilized by frontline staff. A perception of punitive action stemming from incident reports can severely undermine the effectiveness of the reporting system, leading to underreporting and a failure to identify systemic risks. Careful judgment is required to foster a culture of safety where reporting is seen as a tool for improvement, not blame. Correct approach analysis. The correct approach represents best professional practice because it aligns with the core principles of healthcare risk management and patient safety, as emphasized by regulatory bodies and professional organizations like those governing the CPHRM certification. Acknowledging the importance of a non-punitive reporting culture is paramount. This approach prioritizes educating staff on the purpose of incident reporting, identifying system vulnerabilities and opportunities for improvement, rather than focusing on individual blame. This fosters trust and encourages comprehensive reporting, which is essential for effective risk identification and mitigation. This aligns with the spirit of regulations that mandate reporting of adverse events and near misses, aiming to learn from these occurrences to prevent future harm. Incorrect approaches analysis. One incorrect approach fails by focusing solely on the volume of reports without addressing the underlying culture. This can lead to superficial reporting or a perception that the system is merely a bureaucratic exercise, failing to capture critical nuances of patient safety issues. Ethically, it neglects the responsibility to create a safe environment for staff to voice concerns. Another incorrect approach errs by implementing a system that implicitly or explicitly links reporting to disciplinary action. This directly contradicts the principles of a just culture and creates a climate of fear, leading to underreporting of critical incidents. This is a significant regulatory failure, as it hinders the ability to comply with mandates for identifying and addressing patient safety risks. A third incorrect approach is to dismiss reports that do not immediately identify a clear individual error. This overlooks the potential for systemic issues that may be less obvious, but equally, if not more, significant in contributing to patient harm. It represents a failure to leverage the full potential of incident reporting for proactive risk management and can lead to the perpetuation of latent hazards. Professional reasoning. Professionals should approach incident reporting system implementation and management by first understanding the regulatory requirements for reporting adverse events and near misses. Simultaneously, they must consider the ethical imperative to create a safe and transparent environment for staff. The decision-making process should involve engaging frontline staff in the design and refinement of the reporting system, emphasizing its role in learning and improvement. Regular communication about the outcomes of reported incidents, anonymized where appropriate, reinforces the value of reporting and builds trust. This iterative process, informed by both regulatory mandates and a commitment to a just culture, is key to developing and sustaining an effective incident reporting system. Question 20. Research into a healthcare organization's cybersecurity vulnerabilities reveals a lack of comprehensive historical data on the frequency and financial impact of past breaches. The risk management team needs to assess the potential impact of future cyber threats to inform resource allocation for security enhancements. Which risk assessment technique would best serve this purpose, given the data limitations? Option A. A Delphi technique focused solely on gathering expert opinions on the most probable cyber threats without explicitly defining impact levels or likelihood scales. Option B. An ad hoc risk assessment relying on the subjective opinions of IT staff regarding the severity of potential cyber incidents without a structured framework. Option C. A quantitative risk assessment that assigns precise monetary values to the likelihood and impact of each cyber threat based on industry averages, despite the organization's specific data scarcity. Option D. A qualitative risk assessment using defined scales for likelihood e.g., rare, unlikely, possible, likely, almost certain, and impact e.g., negligible, minor, moderate, major, catastrophic to categorize and prioritize identified cyber threats. Correct answer is D. A qualitative risk assessment using defined scales for likelihood e.g., rare, unlikely, possible, likely, almost certain, and impact e.g., negligible, minor, moderate, major, catastrophic, to categorize and prioritize identified cyber threats. Explanation. This scenario presents a common challenge in healthcare risk management, selecting the most appropriate risk assessment technique when faced with limited data and the need for timely decision-making. The professional challenge lies in balancing the rigor of quantitative methods with the practicality and speed of qualitative approaches, ensuring that the chosen method effectively identifies and prioritizes risks without introducing undue bias or overlooking critical factors. Careful judgment is required to align the assessment methodology with the organization's resources, the nature of the risks being evaluated, and the intended use of the assessment findings. The correct approach represents best professional practice because it acknowledges the inherent limitations of available data and prioritizes a systematic, albeit subjective, evaluation of risk likelihood and impact. This qualitative approach, when executed with clear definitions for impact levels and likelihood scales, allows for structured understanding of potential harms and their probability, facilitating prioritization for mitigation efforts. This aligns with the ethical imperative to protect patient safety and organizational integrity, even when precise numerical data is scarce. Regulatory frameworks often emphasize a proactive and systematic approach to risk management, which qualitative assessments can effectively support by providing a framework for identifying and categorizing risks. An incorrect approach that relies solely on anecdotal evidence or personal opinions without a structured framework fails to meet professional standards. This is because it lacks objectivity and can be heavily influenced by individual biases, leading to misprioritization of risks and potentially overlooking significant threats. Ethically, this approach fails to uphold the duty of care to patients and the organization by not employing a defensible and repeatable process. Regulatory failure occurs because such an unstructured method does not demonstrate due diligence in identifying and managing risks, which is a core expectation of healthcare risk management professionals. Another incorrect approach that attempts to assign precise numerical values to likelihood and impact without a robust data foundation is also professionally unacceptable. This can lead to a false sense of precision and may result in misallocation of resources based on inaccurate quantitative estimations. The regulatory and ethical failure here is in creating a misleading picture of risk, potentially leading to a false sense of security or an overemphasis on statistically improbable events while neglecting more probable, albeit less precisely quantified, risks. The professional decision-making process for similar situations should involve a thorough understanding of the available data, the organizational context, and the specific risks being assessed. Professionals should first consider the purpose of the risk assessment. Is it for strategic planning, immediate mitigation, or regulatory compliance? Then, they should evaluate the quality and quantity of available data. If data is limited or subjective, a qualitative approach with well-defined criteria is often more appropriate and defensible. If quantitative data is available and reliable, a quantitative approach can provide greater precision. Regardless of the method chosen, it is crucial to document the process, the assumptions made, and the rationale for the chosen approach. This documentation is essential for demonstrating due diligence, facilitating review, and ensuring accountability.